Summertime's here, which means lots of fun, but there's some safety concerns that comes along with that heat. I'm Zakariah Tazkargy, a physician with COMCARE on Ohio.
Summer has arrived. You probably see people for a little bit different reasons sometimes in the summer, and wanted to talk a little bit about that.
Sure. I'm a big proponent of handouts. So one thing that I've got here with me is a good handout that parents can find online, and it hits on a lot of good things to keep in mind over the summer, especially living in Kansas. The weather can be unpredictable, and so there are several resources that you can find on that handout that will allow you to sign up for frequent weather updates. It'll let you know what the UV index is, and the recommendation would be to avoid playing outside too much when that UV index is really high. And the last thing that really people don't think a lot about is the air quality.
Let's talk a little bit about keeping kids hydrated.
Yeah, so there's actually a pretty distinct cutoff. If your kid's around preschool age or younger, they actually don't regulate their body temperature very well. And part of that will be, them not realizing that they're thirsty until all of a sudden they run up to you and they're beet red asking for water. It's actually pretty important that you've got water available for them right then, because they're helping lower their body temp. Especially for these younger kids, this heat exhaustion and dehydration can sneak up on them pretty quick.
Okay, what are some of the warning signs for heat stroke or heat exhaustion?
That thirst that I mentioned earlier, if they're acting really thirsty, the biggest concerning red flags, I would say, when you need to really start thinking about reaching out to a doctor or going to urgent care and emergency room, is if your child's acting confused and they've been outside, they are bright red, and they're warm to the touch. That's when you start being a little bit more concerned, enough that you might consider, seeking help, medical attention.
Let's talk a little bit about maybe, too much screen time, internet safety. What do you suggest with that?
So the biggest things with the screen time is, basically between the ages of 8 and 12, the recommendation is always going to be under an hour per day of non-educational screen time. And then under the age of 18, it's about 2 hours per day that we try to recommend. But the important thing to keep in mind, especially now is a good time to try to address it with the kids, is internet safety. And it's a huge topic and we could talk forever on it, but the best place to start is for the parents to educate themselves. And there are plenty of resources online. There's kidshealth.org has a good resource that you can use, and then also the American Academy of Pediatrics.
Well, Doctor, thank you so much for some great information, and thank you for watching. For more information, you may visit SalinaRegionalComCare.com and like Salina Regional Health Center on Facebook. Follow us on X and Instagram.